Every day inside these brightly colored walls presents a new challenge for Dr. Dontel Johnson.
It's mainly on his torso. The dry, kind of scaly patches that he has right here is just baby eczema.
Taking care of some of the tiniest patients.
We'll give him some steroid cream for that.
And their worried parents. It's what he was called to do.
I always love science, and I always love kind of helping people.
And where he does it is intentional.
I have the opportunity not only to teach those who look like me and inspire those who look like me to become future physicians, but we're helping people that need help.
Dr. Johnson is an assistant professor at Meharry Medical College and a pediatrician at the Meharry Clinic. The doctors whose pictures hang on this wall have chosen public health care. They are part of a safety net for this city, often caring for the underserved and uninsured. And it all comes at a cost.
You could make more money not being in a public hospital,
Definitely.
right?
Definitely, without a doubt.
What also came at a cost was getting a medical degree.
$583,903.77 worth of loans.
At any point during all your schooling, did you say, is this worth it? Can I do this?
So definitely, can I do this? I knew it was worth it. Like I was feeling that and understanding that, but understanding how I was going to pay for it, I really did not know.
As the loans added up, Dr. Johnson did three things: studied, enlisted in the Army, and applied for the Public Service Loan Forgiveness Program.
It's a lot of paperwork. So I think when I applied, it was at least this thick worth of paperwork.
And then he worked and he waited.
Let me just take a listen to him.
The plan requires 10 years of public service and 10 years worth of loan payments. As of June of 2023, of the 6.1 million applicants to the Public Service Loan Forgiveness Program, just 11% had been approved and their loans forgiven. Then one day, this past spring,
and I'm walking out of the hospital. I checked my emails just to make sure I don't have anything left to do. And I saw that I had an email from the President of the United States of America.
Dr. Johnson became one of a select few.
I open it up, and the first thing is like, congratulations, your loans have been forgiven. I get home, I burst into my house, and I start yelling and screaming. And I show my wife my email on the phone. She reads it. She starts screaming. We tell the kids, we wiped away, like all these loans have been forgiven. And we just had like big, family hug, cry.
In the months since the $500,000 was wiped away,
this could be a little bit more.
Dr. Johnson says one thing has changed.
We'll go see what follow-up is needed for that.
He's practicing medicine with a new sense of freedom. But where he practices will remain the same. No mandate needed.
You get to help anybody who walks through the door day and night, and you don't have to have that fear of like, if I help this patient and I do right by them, am I going to have to eat this cost later on? And I didn't want to practice medicine like that, where I'm like, I can't serve people who need my help just because they can't afford to pay for it.